Welcome to Doctors on Call. I'm Jenna Miller. It is estimated that about 50% of people aged 85 and older have dementia. Dementia is currently the 7th leading cause of death worldwide and has 10 million new cases reported every year. Several diseases and injuries to the brain, such as a stroke, can give rise to dementia. What are the symptoms and when should you see a doctor? Long-term care is a variety of services which help meet both the medical and non-medical needs of people with a chronic illness or disability who cannot take care of themselves for long periods. Life expectancy is going up in most countries, meaning more people are living longer and entering an age when they may need care. We'll tackle these issues and more on Doctors on Call with our guest, family physician, Dr. Tyrel Somers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Dr. Tyrel Somers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Somers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Somers has been affiliated with Russell Regional Hospital since 2015. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for coming back and joining us and tackling another topic. Let's get going with our questions. First of all, what is dementia?
So dementia is a chronic disease that's basically defined by anything that causes a chronic problem with memory loss. And so if an individual is having problems with either a function that's associated with memory loss, or maybe the individual is having problems with just memory in general, any of those things can be classified as dementia. Dementia comes from a variety of different diseases, and it comes in a variety of different forms. And hopefully as we kind of proceed through this, we can talk a little bit about those specifics as well.
Sure. Let's talk about how it's diagnosed.
Yeah, so by far, dementia is one of the more complex medical cases because there's not like a specific blood level test that we can look and say, oh, if we check X, Y, and Z blood, we'll see exactly what's going on. Dementia is more nuanced in the fact that it's much more history collecting. It's also much more kind of observing and talking with families than anything else. And we often notice with like families when people are having problems with their memory or they're having problems with like kind of their day-to-day function, that dementia could be a possibility as to why that's happening. And so we often will get like memory-associated testing, which can be like simple tests that take 5 to 10 minutes to very complex cognitive examinations that can take anywhere between 45 minutes to an hour to formally assess someone's memory. Regardless, a bunch of different tests can be used and kind of help towards the diagnosis of dementia, but by far the easiest way is to sit down and talk with both the patient and family about what kind of problems they're seeing in the individual and discussing if that could be from dementia.
Do you find that some of your patients try to self-diagnose?
It's very common with like families, so by far like when it comes to dementia, the vast majority of people that present with dementia truthfully don't even know that they're really having a problem. Most of the time they come in with like a family member, or you'll hear a family member talk to you in a separate appointment and say, hey, so-and-so's having a problem with a bunch of different things and I want to kind of discuss that at their next appointment. It's by far like their memory is so concerning and so hard for them to keep track of that they really don't even know that they're having a problem with their memory, truthfully.
And what are some of the symptoms?
So by far the biggest thing is having problems with just memory. Now memory is divided up into short-term, working, and long-term memory, and different forms of dementia affect different forms of the memory as well. But for the most part, short-term and working memory are affected more adversely than long-term with the vast majority of dementia patients. The other thing that's really affected is what we call activities of daily living, that we split up into independent activities of daily living and activities of daily living. Those two different things kind of form a divide into more complex versus more simple tasks that people with dementia can struggle with.
And what are the causes?
So, causes for dementia vary. By far the most common one that people are most familiar with is Alzheimer's type dementia, which is a dementia that's primarily focusing on those independent activities of daily living. But there's also dementia that's associated with strokes that can happen because of just specific damages to areas of the brain that's affected. Excuse me. There's also problems with memory and dementia associated with Parkinson's disease. That's more of a movement disorder, but can have with it memory complications and memory problems. There's a form of frontotemporal dementia that's associated with behavioral changes. It's sometimes referred to as Pick's disease. And then there's also just dementia that happens, and we don't really know what it's specifically from. But that doesn't mean that there's not characteristic signs of problems with memory, problems with function, and things like that.
Now, you mentioned Alzheimer's. I think sometimes people confuse that they're one and the same. Let's clarify that.
Yeah, absolutely. And it's one of the number one questions I get asked when people ask me about dementia versus Alzheimer's. So here's the easiest way to describe it. All Alzheimer's disease is a form of dementia, but not all dementias are Alzheimer's disease. Alzheimer's, as I mentioned, is specifically diagnosed based upon problems with the independent activities of daily living, at least at the very initial stages of Alzheimer's disease. We typically see in those people problems with like money management, problems with like balancing spreadsheets, balancing their checkbooks. They have problems with like driving and getting lost and having a hard time getting from place to place. And so that's kind of how the disease begins without any other kind of issues going on in the background. It does eventually progress into activities of daily living, meaning problems with like dressing themselves, toileting, problems eating, problems providing bathing care, all of those things. But that's as the disease progresses. Another thing a lot of people think with Alzheimer's disease is that it's really fast acting, and that, you know, it progresses extremely quickly, and that may not be the case. Some forms of Alzheimer's disease are rather slow and kind of progressive over time. Others are much quicker and rapid. So it really just depends upon if they have a family history of Alzheimer's, if the person has a specific kind of underlying disease or illness that kind of speeds up their Alzheimer's. There's a bunch of things you have to take into consideration when dealing with that.
And who gets dementia?
So anyone is susceptible to getting dementia. It's much more common in families, so there is a kind of hereditary link between some forms of dementia, especially like the Parkinson's disease kind of dementia. And Alzheimer's too runs pretty aggressively in family, but it is a disease that spares no one, honestly. Stroke victims, as I mentioned earlier, can have dementia, and it can happen at any age. Most of the time we're looking at people that are over the age of 65 that see disease, but honestly there's been cases of people who in their 50s and even in their 40s start to have problems with memory loss that they can tie to dementia for a myriad of different reasons, truthfully.
And at what point should you or a loved one see the doctor?
So by far the biggest thing is looking at those independent activities of daily living, and if you're seeing problems with an individual for any reason, to have them assessed by a doctor is completely fine and completely worthwhile. Most of the time, like, there'll be a series of questions that a physician will ask that kind of just figure out if it's really something that's going on or not. And as I mentioned kind of earlier, there's specific cognitive examinations that we'll often do to kind of discern what type of memory is being lost, if there's problems with activities of daily living, if there's problems that could be associated with the diagnosis of dementia. So.
And does memory loss mean that dementia is or might be starting?
Yes, so that's by far the hallmark of dementia, is that memory loss specifically. And so if you are suffering from problems from memory loss, keeping in the back of your mind that that's a possibility that dementia can be there is definitely a possibility. One of the things that can cause memory loss that isn't is like an acute injury. So for example, if someone gets like a concussion, or they have like a disease, they're confused because of like an infection, any of those things can cause memory loss, absolutely. But if you're seeing a more chronic, more slow, more delayed memory loss that's progressive over a period of months to years, the likelihood of dementia is very high in that regards.
And what are some of the complications that arise because of dementia?
So dementia is extremely challenging because the individual starts to have kind of problems slowly over time, but on top of that too, their ability to effectively communicate what they're truly feeling, what they're truly thinking, is just not nearly as good as it was. And so they often have complications that lead to pretty severe infections. They can have like urinary tract infections, pneumonias, things like that, that unless you're paying very close attention to their vital signs, paying very close attention to their underlying signs, you can miss sometimes, in which case they can can go into sepsis and end up passing away from sepsis because of the complications. Another very common thing that happens with dementia patients is fractures, because they get up to ambulate, they get up to walk around and go to the bathroom, get up and get food or whatever they're thinking, and because their feet aren't as steady as they should be, and also too because they just can't ambulate successfully, they end up with falls and then end up with fractures that end up causing a world of complications. And so there's a lot of things that kind of lead towards a dementia patient kind of having a higher mortality risk compared to other individuals.
And we talk a lot about prevention on the show. We like to talk about that. Is there any way of preventing dementia?
At this moment right now, there's certain things you can do for certain types of dementia to help prevent them. So for example, if I knew you were going to have a stroke prevention is really important. Taking care of yourself with both your blood pressure, making sure your cholesterol levels are appropriate. All of those things help reduce stroke risk, and so doing those things would make perfect sense to prevent that type of dementia. But for the most part, when people ask me that question, they're asking specifically about Alzheimer's disease. Alzheimer's disease, there's no way to really truly prevent it. By far the best thing that you can do is keep your brain mentally active. Think of it more as like a muscle than anything else. If you're exercising it and using it daily, the likelihood of you progressing into a worsening form of dementia is lessened. So I often tell folks, like if you're keeping your brain active with puzzles, with tasks, with different things, it's much more important, and that will kind of help slow down or kind of prevent, for lack of a better term, dementia, though that's not truly what it does.
You had mentioned Parkinson's disease earlier. Are there other disorders that can cause dementia symptoms, such as Huntington's disease?
Yeah, so there are a ton of neurological symptoms and neurological diseases that also can cause forms of dementia. You mentioned specifically Huntington's disease, which that's much more prevalent in younger folks. It's a very advanced neurodegenerative disease that can cause problems. Multiple sclerosis has been linked with a form of dementia as time progresses with those individuals. Parkinson's disease we mentioned is one as well. I mentioned a very specific one, Pick's disease. There's one that's caused by too much cerebral spinal fluid within the brain. That's called normal pressure hydrocephalus. It causes a very unique form of dementia as well. And dementia kind of can be thought of not only just as a disease, but sometimes as a sign or a symptom of another underlying disease. And so whenever you see that memory loss, that problem, like you have to make sure before you just say, oh, this is just dementia, to try to quantify and evaluate if there could be another source and another reason why it's happening, because then it might be something that you can do a treatment for to help minimize their symptoms.
And can dementia cause hallucinations?
Yeah, so dementia in the later stages can definitely cause hallucinations, and it's not necessarily that the individual is like seeing something directly. It's more of a misinterpretation within the brain. A lot of the times, like their memory kind of starts to have even more problems, and so when they look and see, like for example, I'm looking at a camera right now. The camera to me looks like a black tripod camera, but to a person with dementia, they may not recognize what that is. They may not see in their brain that, hey, that's a camera, and might instead think, oh my goodness, that's an alien that's coming, because it could look like the War of the Worlds aliens that people have seen, and they might freak out that that's the case. Or it might look like a human because it's got an eye, it's got like a rounded top, and they might say, oh, I saw a child, when truthfully they didn't see that, they saw a camera. And they kind of can get confused about a lot of different things. If people are coming in and out of the room that they don't recognize, they might try to attach that to like a family member. So sometimes we have people, they come in and they say, oh, I saw Grandma Jill, last night. Well, Grandma Jill's been dead for 20 years. How is that possible? Well, the thing is they might have saw a nurse come in that kind of looked or resembled Grandma Jill or didn't, and they just did the best they could with the information they had and came up with an answer.
Interesting. And now everyone knows what our in-studio cameras look
Yeah,
like.
exactly. Sorry, I let the secret out on those.
Now, are there dementia-like symptoms that can be reversed with treatment?
So dementia treatment is kind of a unique thing in that most of the time, if you correct the underlying source of the dementia, it can improve their memory a little bit. So for example, like with a patient who has normal pressure hydrocephalus, if you can find a way to decrease the cerebral spinal fluid, you can sometimes improve the memory of the individual and they can get a little bit better. Alzheimer's disease is unique in that we don't have a very specific treatment yet at this time. There are 2 medications that have been recommended to help slow down the progression of the dementia. That's the medications Aricept and Namenda. The problem is they don't fix the disease. Really, the idea is this. I tell often families without that, their Alzheimer's would probably progress in a period of like 7 to 10 years. Whereas with Namenda and Aricept, it might be 14 to 18 years. It kind of gives a little bit more time to families to kind of help them get used to their situation and their environment and make sure that they got everything set up to take care of the individual. But yeah, unfortunately, there's just no direct treatment at this time for Alzheimer's disease, which hopefully in the future will continue to progress and make it so that eventually we do have cure, we do have treatment.
Excellent. We want to remind our viewers that we are talking about dementia tonight and also long-term care with our doctor, Dr. Tyrel Somers from Russell Regional Hospital. Give us a call at 800-337-4788 if you have a question. So what happens to a person's brain and body as the dementia gets worse?
So by far the biggest thing that we notice is generalized atrophy that can happen within the brain. We see kind of the cerebellum, which is the complex decision-making, memory storage area of the brain start to kind of shrink over time. It's a lot more progressive in individuals with dementia compared to the general population. A secondary thing that we can sometimes see with dementia, though, is just generalized kind of poor care overall. And so they start to have problems remembering to feed themselves and to take care of themselves. So they go from being very presentable individuals to starting to get a little bit disheveled in their appearance, a little bit poor in their appearance. They start to lose weight. They don't take care of their teeth as they were supposed to previously. And so they start having problems with increased dental issues. They start smelling, unfortunately, because they're just not taking showers or not wearing deodorant and doing things that they normally would have done. And so that can also be another clue in an individual if you're not sure if a family member isn't really watching them. I've had a few patients who that's how we've caught it is they've come in multiple times, and over time I'm like, yeah, you're not really taking care of yourself the way you did, 2 or 3 times before. And it can kind of be that clue that, hey, maybe we need to test your memory and make sure you're not developing dementia.
And can you control risk factors for dementia?
Yeah, some of the risk factors for dementia can be controlled. They can be minimized. As I mentioned, stroke prevention is really important if you don't want to get stroke-associated dementia. Parkinson's disease, if you treat Parkinsonism with the medications that are there for it, primarily dopamine-based medications, that can minimize the symptoms of dementia too and make that a whole lot easier to take care of. Normal pressure hydrocephalus we talked about. Pick's disease has a very specific medication that can be given to it that tends to help a little bit with the dementia as well. You can take different types of things to kind of help minimize those risks. So yeah, there are some preventative things that can be done.
Okay. We're going to shift our conversation a little bit here to long-term care. Let's start with who needs long-term care.
So that is a great question, and one that is extremely hard as a physician to truly answer and truly give an answer to a family. Long-term care is one of the hardest decisions that a family ever has to make when it comes to taking care of their loved ones. Oftentimes, I look at it this way. Everyone has a unique need when it comes to their overall care, and so sometimes you're required to find kind of that additional help that someone might need. That alone might be enough for long-term care. For some people, long-term care is a way for them to interact. If they don't have a way to go out and get the things that they need to care for themselves, sometimes long-term care placement allows them to receive services and receive socialization that they weren't getting previously, which can be a really game changer for a lot of those folks.
Sure. And what is the goal of long-term care?
So the goal of long-term care is to provide not only just basic medical care to an individual, but to provide overall care for an individual. Think about those activities of daily living that I mentioned earlier. Bathing, toileting, dressing themselves, taking care of teeth, transferring. All of those things are really important in day-to-day living for individuals. And if they can't perform those things at home, having nursing staff, nursing aides, even having just general people to assist with it is really important. So long-term care can kind of fill that role for individuals.
And what are some different types of home-based long-term care options?
Yeah, so it's a great option or a great question. There's a ton of different ways that long-term care can be provided. For the most part, whenever you hear the word long-term care, a lot of people assume that's nursing home level care. And while nursing home level care is kind of the apex, it's kind of the highest form, it's not the only. And home care is by far one of the most common things that people would prefer. They'd love to stay in their home if they can. We'll begin with our discussion on home health. Home health care is a kind of service that's provided by different entities that bring in skilled nurses to kind of help with medication management, with disease management, with education, with a whole bunch of different services. That's kind of paired in tandem with therapy services, so occupational therapy, physical therapy, speech therapy. All those are fantastic. They also provide bathing cares with aides that come in. They'll also do some toileting, just regular care. Another thing that is important to know in home care is you can have home caretakers. They're private individuals that would come in and they would do kind of around-the-clock care for some individuals. While it might be expensive, it's a very good service because you're basically providing similar to nursing home level care in the home with the individual. They're providing toileting assistance, bathing assistance, meal preparation, pill preparation, like all of these different very unique services. And it allows people to stay at home a lot longer than probably they would normally get to, which is incredible.
Absolutely. And how does a person seek those services out?
So by far the biggest thing to know is if you think that you need those services, getting assistance from a physician and a licensed social worker, always a good place to start. By far in our facility, the easiest way is to just contact our facility and kind of say, hey, I'm in need of some additional help, and I'd like to get set up with home care. In which case we can give you a list of agencies that provide those services in our local area. We're blessed to have several different agencies to choose from in the Russell area. That makes it very easy to get a hold of. And very, very easy to get people out there that can really take good care of people. So I've been impressed with our home health care agencies. I recommend them to a lot of patients, whether it be just because they need additional help, whether it's because they've been hospitalized and need services to kind of transition back to home safely. It's very easy to get a hold of, and I work with wonderful social workers at our facility that help kind of me make sure that I'm getting the right services for those people.
Sure. And what should you look for in choosing long-term care?
So when we're looking at long-term care specifically, you kind of want to know what your needs are. If it's something that can be filled within the home, home health care is a good option for you. But you might need to divide yourself between the other types of long-term care, which now is a great time to talk about them. The first one's assisted living care. And assisted living care is basically like a community that is all together, that has like a centralized nursing staff that takes care of them, but doesn't provide advanced levels of activities of daily living. So what I mean by that is they may be able to assist you minor in like your bathing or in your dressing, but they wouldn't really help you with eating. So it's kind of good for those people that need just a little bit of help, but not a lot of help. The benefit of it too is the price is it's better than what it would be in the home. In like the nursing home level care. So it's a good option for an individual who's having some trouble, but not enough trouble that they need nursing home level care. Which then brings us to our last thing, which is nursing home level of care. Now, there are different types and styles of nursing homes, and I won't go into that completely. That's a lot of time to speak about. But nursing home level care is basically when an individual just can't take care of themselves at home in a safe and effective way. They need to get additional care and additional services. That's kind of where that comes in. And so making sure that they have those activities of daily living, independent activities of daily living, socialization aspect, medication management, they take care of everything.
Sure. And what is the difference between chronic care and long-term care?
Yeah, so chronic care is something that, and that's another wonderful question. Chronic care is something in which we manage the specific medical complications that an individual has. So for example, I take care of patients in a nursing home. I take care of like their diabetes, their high blood pressure, take care of like thyroid disease, any other complications that they have. And by managing that, I'm managing their chronic care. And so it's management that occurs of specific disease ailments over a long period of time. Sometimes chronic care management can be done by nursing staff. Sometimes it's done by physician staff. Sometimes it's done by everybody, and that's a great thing. Whereas nursing home level care specifically is trying to focus more on just making sure that the individual has those daily living things that they require. And making sure that they're eating well and doing all the things that come hand in hand with chronic care, but just aren't included in chronic care because it's a much more skilled and specialized service.
Sure. And the hard question of who pays for most of long-term care?
So long-term care is divided up in several ways in how it's paid. By far, like when you get to nursing home level care, payment can happen in a plethora of different ways. The most common way is for like Medicare, Medicaid to take care of payment, especially for those individuals that are having a hard time giving that type of money to that kind of service because they are quite expensive medical services. The other thing that is used is people who have like insurance that would be helpful for long-term care. If you're a young individual or someone who's in middle age that is thinking eventually they'll need long-term care, it's actually a very smart thing to kind of investigate and look into, for sure. Because it is beneficial to help pay that gap and help make sure that you can get the long-term care that you need when you get older. The other people that pay is sometimes families have like trusts, or sometimes they have like money that's set aside specifically for long-term care for family members to take care of them. All those things are great ways to kind of provide those services and help kind of get the care that an elderly person would need.
Sure. And is there caregiving training available?
Yeah, so there's definitely different resources that are available. Our area has a area agency on aging that does a fantastic job showing just random different ways in which people can get assistance. They work hand in hand with the home health care that we spoke about earlier. They help with like social work management to make sure that people are getting resources that they need. Durable medical equipment they help with as well. So helping people get like walkers and home devices that they might need in combination with physicians. The area agency of agents shows like a good resource for like just general information as well, like going there and talking about dementia and getting information about what the actual individual is seeing and dealing with. They're a fantastic resource for sure.
Excellent. Well, thank you so much for coming back on our show, Dr. Somers from Russell Regional Hospital. On our next Doctors on Call, we'll be discussing breast and prostate cancer. You can email questions for our next program. That address is doctors@shptv.org. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.